Hi, Assalamualaikum. My name is ARINA binti Abdul Rashid. I am student of University Malaysia Kelantan and my matrix numbers is H17E0415. So today I'm going to presenting a little bit about my individual assignment of subject health promotion. This assignment is about the online mental health program that conducted by Dr. Siti Fatimah, and the speaker is Dr. Muhammad Afifuddin from University Science Malaysia that held on 24th November 2020. So basically, this assignment is based on Chapter 3, which is the Health Program Planning Model for Change and Prevention. So, based on the data given, we are going to use the Precede-Proceed model. In Precede-Proceed model, there are 9 phases. The Precede-Proceed model is a comprehensive structure that assessing the health needs for designing, implementing, and evaluating the health promotion and other public health programs to meet those needs. Precede provide the structure for planning a targeted and focused health program, while Proceed provide the structure for implementing and evaluating the public health program. Now I'm going to explain a little bit about those 9 phases. Precede stands for predisposing, reinforcing, and enabling construct in educational diagnosis and evaluation. First is social assessment. Social assessment is to determine the social problems and needs of the target population and identify the desired result. The second one is the epidemiological assessment. This is to identify the health determinants of the identified problems and set priorities and goals. The third one is the ecological assessment. Ecological assessment is to analyze the behavioral and environmental and enable the behaviors and lifestyle. Next is match appropriate intervention, which is to identify the administrative and policy factors that influence implementation, that encourage desired and expected change. And the last one in Precede is the implementation of intervention. While Precede stands for policy, regulatory, and organizational construct in educational and environmental development, it involves the identification of desired outcomes and program implementation. First is the implementation. Is to design the intervention, assess availability of resources, and implement program. Next is process evaluation. Is to determine if program is reaching the targeted population and achieving desired goals. The third one is the impact evaluation. Is to evaluate the change in behavior. Last but not least is the outcome evaluation. Outcome evaluation is to identify if there is a decrease in the incidence or prevalence of the identified negative behavior or an increase in identified positive behavior. The phases that has been involved in the online health program that have been held on 24th November 2021 from Dr. Afifuddin is the phases 1, phases 2, phases 3, and phases 6. Phases 1 were involved because the data has said is the certain population which is include male and female from wellness and tourism student in University Malaysia Kelantan. Phases 2 is to identify the health determinant in among the student which is stress, anxiety, and depression. Phases 3 were involved because there is some factor that could link to the health problems. The factors may include the internet connection coverage, the online learning, and the group assessment. This may code and link to the stress, anxiety, and depression. Last but not least is phase 6. This is how you implement the program. The University Malaysia Kelantan students implement the program by giving the talk. Next is the recommendation. So my recommendation for the future health promotion program is to make the incentive and appreciation to the participant. It will make the participants feel happier and make them feel appreciated so that they will be happy for joining the program. The incentive could be the certification. So the online program could be provide the certification of participant to all the participants that participating the programs, and also could give the appreciation such as a certificate of appreciation to the speaker of the program. Next, I would like to suggest for program that conduct more activities and less talk. This is because the participant would be more likely to do the activities rather than just hearing the talking, and I think that is much effective for them to get the input. So that's all of my recommendation. Thank you.